Welcome back. We're talking about seasonal allergies with Dr. David Kluge. Thanks for staying with us, Doctor. So can you talk about, some people develop seasonal allergies later in life. Why does that happen?
That can happen for several different reasons, and it's actually kind of controversial and not really well understood at all. But it can go both ways. People can develop allergies as they get older, and they could have had severe allergies when they're younger, and then kind of grow out of them as they get older as well. And that can happen with asthma as well. You could have severe asthma as a child and then grow out of it as a teenager, or never have asthma at all in your life and then have it when you turn 30 or 40 years old. Some of the mechanisms are understood a little bit, and one of the mechanisms that I've noticed a lot is hormonal changes, and that affects men only once in their life when they go through puberty, and their allergies and asthma can change significantly at that time in their life, and then over the course of their life, over usually years or decades, can also change, but usually much more slower. But when the hormonal changes can happen rapidly in the period of months or even a year. And then for women, they have the same thing, with puberty, but then every time a woman gets pregnant, of course her hormones are going to be in a state of flux, and so that can change her immune system. And she can go from having no allergies to having severe allergies, or again, the other way around as well. She can develop food allergies. Sometimes the food allergies will be permanent. Sometimes the food allergies will go away after she gives birth. It's very interesting because then the child can go on to develop allergies that were similar to the mother's when she was pregnant. So it's very interesting. And then finally, with women with the menopause, their allergies can also change one more time, again in a fairly rapid. Menopause is a fairly lengthy period, but still it can, over a period of a short couple years, it can change, pretty remarkably that way. And again, with asthma can do the same thing. Okay. So that's one main mechanism that we do understand, but lots of other mechanisms do exist for adult onset allergies. Some of those can also have to do with exposures, moving to a different area of the country, having a new house, having had an incident in your house with water or flooding or mold in your house, new animals in the house. All those things can trigger allergies as the adult's onset. And a lot of them can be figured out, but a lot of them cannot.
Okay. Are there times when someone might have an allergic reaction, especially to seasonal allergies, for example, that is so bad they would need to seek out emergency help?
Typically with traditional allergic rhinitis and allergic conjunctivitis, which is the nasal and eye symptoms, those are just very inconvenient, but not necessarily life-threatening. As we spoke about before, though, when the allergies can trigger an asthma reaction or a lung issue, then that can become life-threatening and have to be seen in an emergency setting, yes. Okay.
Are there some things that folks can do to sort of keep control of those symptoms related to seasonal allergies?
So avoidance is the key. If you know what triggers you, if you know what you're allergic to, then trying to avoid those particular things is the number one thing to do. And if you do have exposure, then trying to basically decontaminate yourself as fast as possible after the exposure. So let's say that you know that when you mow the lawn that your eyes are going to swell up and you're going to have trouble breathing. So then you can mow the lawn. You might want to wear a mask if you're very severely affected. As soon as you get done mowing the lawn, though, you'd want to come inside, take your clothes off, put them in the wash, get in the shower, and then something that people don't usually think about is your nose filters all that air that you're breathing, and so getting your nose washed out, just like your body washed off, is important. So using nasal saline spray, ocean spray, or simply saline, some form of a generic of that is also great to wash out your nose and get it cleaned out.
Okay, those are great tips. Can someone get tested to find out what allergies they have?
Yes, that's the purpose of the first step of allergy treatment is if you have symptoms that are not controlled with traditional medications, then going and getting seen by an allergist and getting tested. So we can find out almost exclusively what you're allergic to, yes.
Okay, are there potentially any side effects to those tests?
The test can cause typical allergic reactions. So if you are very uncontrolled, the test can put you into an asthma reaction, which would be very rare, but can occur. Testing has occurred in two different ways. We do skin testing, which we actually put a little piece of what we think you might be allergic to under your skin as a scratch test, or as an intradermal test. Those tests are anywhere from not uncomfortable at all to being moderately uncomfortable, not really painful, but they can be a slightly uncomfortable test. Most of the testing does not even involve needles, though, but some testing sometimes does involve the needles. And that testing can be very minimally dangerous, but again, we're allergists, and so we're trained in allergy reactions, and we're set up for those kind of reactions in the office if anything happens. The other part of testing that can be done is blood testing, which is where your blood is drawn and they test your blood for different antibodies. for things that you might be allergic to as well. Of course, that test is just as dangerous as getting your blood drawn, which isn't really dangerous at all. But those are the two different ways. Skin testing is considered much more accurate in general, so we try to do skin testing if we can.
Okay. Does insurance typically cover those types of tests?
Insurance usually, almost universally, insurance covers those tests, either the skin testing or the blood testing, and it just depends on what your insurance, co-pays might be or deductibles to be met, but otherwise it's very well covered. Okay,
great. Are there prescription medications that people might get prescribed if they finds out they're allergic to something?
So there are. At this time, most of the medications that we had in our tool bank of medications, toolbox of medications, are over the counter, which is very convenient for patients. But there still are some prescription medications, and those would include medications that we'd use for asthma, as we talked about before, with either a rescue inhaler or daily inhalers, or medication such as Singulair or Montelukast. And that's one of the only prescription medications left that we can prescribe patients, and that works for allergies and asthma. And when it does work, it works very well, but sometimes it doesn't work at all for some patients.
Okay, so you mentioned prescription over-the-counter meds. Any side effects that people should be aware of when taking those kind of medications?
So the over-the-counter medications, which used to be prescription, which are now over-the-counter, would include like Flonase or Nasonex or Rhinocort's nasal sprays. And those are steroid-based nasal sprays. They work very well for nasal congestion and nasal drainage and sneezing, but mainly congestion and drainage. The number one side effect for any of those nose sprays is going to be nosebleed. Second most common side effect is going to be headache. They're not addictive nose sprays. There are some nose sprays over-the-counter, which I do not recommend, which are addictive, and basically your nose gets addicted to those nose sprays, and those are awful, and those are the Afrin or the nasal four-way nose sprays, which should be avoided unless you're sick and only should be used for a couple days in a row. Okay. But the Nasonex, the Flonase, the Rhinocorts, and those ones are great to use long-term and not addictive.
Okay.
Other class of medications over the counter would be the antihistamines, and that includes the old-fashioned Benadryl, which works great. Everybody's taking Benadryl. It makes most people very sleepy. It only lasts for 4 hours, but it works very well. It's the most potent antihistamine that really we have. If you go to the ER with an asthma attack, they're going to give you Benadryl. So it works great. Okay. And I recommend if you're having a severe attack to use a liquid Benadryl, like a children's Benadryl, or a liquid gel Benadryl, because it's absorbed faster in your body. But other antihistamines, which are newer than Benadryl, which don't cause as much sedation, would be Claritin, Zyrtec, Allegra, or Xyzal, which is one of the newer ones as well. Zyrtec and Xyzal can cause some sedation, but typically Allegra and Claritin do not cause much sedation. Unfortunately, though, Claritin and Allegra don't seem to work as well as Zyrtec and Xyzal. Okay. Xyzal and Zyrtec seem to be stronger, but they can cause about 10% of people to be sleepy.
Okay, perfect. All right, doctor, thank you so much. We're going to take another break, but we'll be back right after this. Stay tuned.